Hello everybody, this is Dr. D. Kavita, Assistant Professor, Department of Biochemistry, Biotechnology and Bioinformatics, Avanashingam Institute for Home Science and Higher Education for Women, Coimbatore, Tamil Nadu. In this module, you are going to see about the inborn errors of lipid metabolism. Fats are an important source of energy for the body. The body's store of fat is constantly broken down and reassembled to balance the body's energy needs with the food available. Groups of specific enzymes help the body break down and process fats. Certain abnormalities in these enzymes can lead to the increase of specific fatty substances that normally would have been broken down by the enzymes. Over time, accumulations of these substances can be harmful to many organs of the body. Disorders caused by the accumulation of lipids are called lipidosis. Other enzyme abnormalities prevent the body from converting fats into energy normally. These abnormalities are called fatty acid oxidation disorders. Numerous genetic disorders are caused by errors in fatty acid metabolism. These disorders may be described as fatty oxidation disorders or as a lipid storage disorders and one of several inborn errors of metabolism that result from enzyme defects affecting the ability of the body to oxidize fatty acids in order to produce energy within muscles, liver and other cell types. Hereditary disorders in lipid metabolism include Tay-Sachs disease, Gaucher disease, Niemann-Pick disease, metachromatic leukodystrophy, Fabry disease, Refsum's disease and Tangier disease. These lipidosis are characterized by dysfunctional lipid metabolism and result in abnormal metabolite accumulations. After completing this module, you will be able to define the inborn errors of lipid metabolism. You will understand the lipid metabolism behind these diseases. You will also understand the various types of lipid storage diseases. To define this, inborn errors of metabolism form a large class of genetic diseases involving congenital disorders of metabolism. The majority are due to defects of single genes that code for enzymes that facilitate conversion of various substances, or you call it as substrates, into the others, that's the products. In most of the disorders, these problems arise due to accumulation of substances which are toxic or interfere with normal function or to the effects of reduced ability to synthesize these essential compounds. Inborn errors of metabolism are now often referred to as congenital metabolic diseases or inherited metabolic diseases. Let us see the first type, that's the acid lipase disease. Acid lipase disease is a name used to describe two related disorders of fatty acid metabolism. It occurs when the enzyme needed to break down certain fats that are normally digested by the body is lacking or missing, which results in the toxic buildup of these fats in the body cells and tissues. These fatty substances called as lipids include waxes, oils and cholesterol. Three rare lipid storage diseases are caused by the deficiency of the enzyme lysosomal acid lipase. Lysosomal acid lipase deficiency, Wolman disease and cholesterol ester storage disease. Now let us discuss the first type, lysosomal acid lipase deficiency, which is abbreviated as LAL deficiency or LALD, which happens when the body does not produce enough active lysosomal acid lipase enzyme. This enzyme plays an important role in breaking down fatty material, that's a cholesterol esters and triglycerides in the body. Infants, children and adults that suffer from LAL deficiency experience a range of serious health problems. The lack of the LAL enzyme can lead to a buildup of fatty material in a number of body organs, including the liver, spleen, gut, in the wall of blood vessels and other important organs. Very low levels of the LAL enzyme lead to LAL deficiency. Historically, it's called as Wolman disease after the physician who first described it. LAL deficiency typically affects infants in the first years of life. The accumulation of fat in the walls of the gut in early onset of disease leads to serious digestive problems including malabsorption. That's a condition in which the gut fails to absorb nutrients and calories from food. Because of these digestive complications, affected infants usually fail to grow and gain weight at the expected rate for their age. As the disease progresses, it can cause life-threatening liver dysfunction or liver failure. Next comes the second type, that's the lysosomal storage disorders. Lysosomes are cytoplasmic organelles in which a variety of macromolecules are degraded by different acid hydrolase enzymes. Lysosomal enzymes are coded for by nuclear DNA and are targeted to lysosomes by specific recognition markers. If a lysosomal enzyme is absent or has reduced activity, or if enzymes are not correctly targeted to lysosomes, the macromolecules normally degraded by lysosomes will accumulate, which results in the abnormal storage of various complex compounds including glycolipids, glycosaminoglycans, oligosaccharides and glycoproteins. Lysosomal storage disorders are autosomal recessive except for Fabry disease and Hunter syndrome, which are X-linked disease. Abnormal macromolecule storage leads to a variety of signs and symptoms depending on where the storage occurs. Some diseases, for example Gaucher's disease type 1, usually affect only peripheral tissues such as liver, spleen, bone, and others affect only the central nervous system, just like the Tay-Sachs disease, while yet others affect both brain as well as the systemic organs, that's like Niemann-Pick disease. Characteristics of many lysosomal storage disorders, it include coarsening of facial features, eye abnormalities, enlarged liver and spleen, and bone disease. As a group, these conditions cause severe neurological impairment, often starting in infancy. However, each disease often has a spectrum of severity depending on the degree of enzymatic compromise. For example, although Tay-Sachs disease is often fatal in early childhood, some forms do not present until adulthood. Most lysosomal storage disorders have no therapy except for supportive care. The difficulty with most therapies is that they do not enter the brain because of the presence of the so-called blood-brain barrier. Bone marrow transplantation has been attempted in individuals with lysosomal storage disorders, but overall results have been disappointing. Successful therapy for disorders without central nervous system involvement has been accomplished. Gaucher disease type 1, for example, is responsive to enzyme replacement therapy, that is, frequent intravenous infusions of the specific enzyme that is missing in the disorder, and encouraging results have been reported in Fabry disease and Pompe disease. Now let us see about the Fabry disease. Fabry disease is a rare genetic lysosomal storage disease inherited in an X-linked manner. Fabry disease can cause a wide range of systemic symptoms. It's a form of sphingolipidosis as it involves dysfunctional metabolism of sphingolipids. What are the symptoms of this disease? Symptoms are typically first experienced in early childhood and can be very difficult to understand, and the rarity of Fabry disease to many clinicians sometimes leads to misdiagnosis. Manifestations of this disease usually increase in number and severity as an individual age. What are the treatment for this Fabry disease? The first treatment for Fabry disease was approved by the US FDA on April 24, 2003. Fabrazyme was licensed to the Genzyme Corporation. It's an enzyme replacement therapy referred as ERT, designed to provide the enzyme which the patient is missing as a result of a genetic malfunction. Pain associated with Fabry disease may be partially alleviated by enzyme replacement therapy in some patients, but pain management regimes may also include analgesics, anticonvulsants, and non-steroidal anti-inflammatory drugs, though the latter are usually best avoided in renal disease. What are the prognosis of this disease? Life expectancy with Fabry disease for males was 58.2 years compared with 74.7 years in the general population, and for females it is 75.4 years, which is compared with the 80 years in the general population. The most common cause of death was cardiovascular disease, and most of those had received kidney replacements. Now let us see the next lipid disorder, that's the Refsum's disease. Refsum's disease is a rare but severe neurological disorder characterized by cerebral ataxia and peripheral neuropathy. The patients of this disease accumulate large quantities of an unusual fatty acid, phytanic acid. It is derived from phytol, a constituent of chlorophyll. Hence, it is found mostly in plant foods. However, it is also present in milk lipids and animal fats. Phytanic acid cannot undergo beta oxidation due to the presence of a methyl group on carbon 3. This fatty acid undergoes initial alpha oxidation to remove the carbon as carbon dioxide, and this is followed by the para oxidation. Refsum's disease is caused by a defect in the alpha oxidation due to the deficiency of the enzyme phytanic acid alpha oxidase. The result is that phytanic acid cannot be converted to a compound that can be degraded by beta oxidation. The patients should not consume diets containing chlorophyll, that is green leafy vegetables. So, Refsum's disease results from a genetic defect in phytonyl-CoA hydroxylase, which leads to very high blood levels of phytanic acid and severe neurological problems including blindness and deafness. It is also known as classic or adult Refsum disease. Phytanic acid oxidase deficiency and phytanic acid storage disease is an autosomal recessive neurological disease which results from the overaccumulation of phytanic acid in cells and tissues. What are the causes of this Refsum's disease? It's a paroxysmal disorder caused by the impaired alpha oxidation of branched chain fatty acids, resulting in buildup of phytanic acid and its derivatives in the plasma and tissues. This may be due to deficiencies of phytonyl-CoA hydroxylase or pyroxene 7 activity. In general, Refsum disease is caused by PHYH mutations. The treatment for this Refsum diseases are: the individuals with Refsum disease are commonly placed on a phytanic acid restricted diet and avoid the consumption of fats from ruminant animals and certain fish. Recent research has shown that CYP4 isoform enzymes could help reduce the overaccumulation of phytanic acid in vivo. Plasmapheresis is another medical intervention which is used to treat patients. Wolman disease is the next important type. Wolman disease is a rare genetic disorder which is caused by a deficiency of an enzyme known as lysosomal acid lipase. This enzyme is necessary to break down certain lipids inside the cells. Deficiency of this LAL enzyme causes a buildup of fat in the liver, gut and other parts of the body. Wolman disease belongs to a group of diseases known as lysosomal storage diseases. Lysosomes function as recycling centers within the cells, breaking down a number of unwanted material into substances that the cells can reuse. The enzymes are highly specialized proteins within these lysosomes that break down or digest particular nutrients such as certain fats and carbohydrates. Wolman disease is the early onset form of LAL deficiency. This form of the disease typically develops during the first few weeks or months of life. Late onset form, which is known as the cholesterol ester storage disease, typically presents later in childhood or even adulthood. The symptoms of this Wolman disease usually appear shortly after birth, typically in the first few weeks of life. Affected infants may have the following: feeding difficulties with frequent vomiting, diarrhea, swelling of the abdomen, enlargement of the liver and spleen, failure to gain weight or sometimes weight loss. What are the prognosis of this Wolman disease? There are currently no approved treatments for Wolman disease, and no treatments have been shown in clinical trials to stop or reverse this abnormalities in patients with Wolman disease. Treatment is mainly focused on reducing specific complications, and these complications may differ between patients. Treatment is often provided in specialized centers and may require input from a team of different specialists. Genetic counseling may be of benefit for affected individuals and their families. Specific interventions may include a change from breast or normal bottle formula to a specialized low-fat formula, introduction of intravenous feeding, antibiotics for the infections, steroid replacement therapy because of concerns about adrenal function. The next important type is the metachromatic leukodystrophy. It's referred as MLD. It's also called as aryl sulfatase A deficiency, and it's a lysosomal storage disease which is commonly listed in the family of leukodystrophies as well as among the sphingolipidosis, as it affects the metabolism of sphingolipids. Leukodystrophies affect the growth and development of myelin, the fatty covering which acts as an insulator around nerve fibers throughout the central and peripheral nervous systems. MLD, it involves cerebroside sulfate accumulation. Metachromatic leukodystrophy, like most enzyme deficiencies, has an autosomal recessive inheritance pattern. The next tangier disease is the familial alpha lipoprotein deficiency. The plasma HDL particles are almost absent, that is the high density lipoprotein particles. Due to this, the reverse transport of cholesterol is severely affected, which leads to the accumulation of cholesterol esters in tissues. An absence of apoprotein C2, which activates lipoprotein lipases, also found. The plasma triacylglycerol levels are elevated. The affected individuals are at an increased risk for atherosclerosis. Next disorder which is due to the blockade in beta oxidation is SIDS, that is the sudden infant death syndrome. It is an unexpected death of healthy infants. Usually it occurs overnight. The real cause of SIDS is not known. It is now estimated that at least 10% of SIDs is due to deficiency of medium chain acyl-CoA dehydrogenase. The enzyme defect has a frequency of 1 in 10,000 births and is in fact more prevalent than phenylketonuria. The occurrence of SID is explained as follows. Glucose is the principal source of energy soon after eating or feeding babies. After a few hours, this glucose level and its utilization decreases, and the rate of fatty acid oxidation must simultaneously increase to meet the energy needs. So, the sudden death in infants is due to a blockade in beta oxidation caused by a deficiency in medium chain acyl-CoA dehydrogenase, that is MCAD. Children with medium chain acyl-CoA dehydrogenase deficiency, that is MCAD, appear completely normal unless they fast for a prolonged period or are faced by other metabolically stressful conditions such as a severe viral illness. During periods of metabolic stress, affected individuals may develop hypoglycemia, lethargy, vomiting, seizures and liver dysfunction. Intravenous hydration and glucose must be given in a timely fashion, otherwise the disease can be fatal. However, if hydration and nutrition are monitored closely, children with MCAD lead a relatively normal life. The next one is the Jamaican vomiting sickness. This disease is characterized by severe hypoglycemia, vomiting, convulsions, coma and death. It's caused by eating unripe ackee fruit which contains an unusual toxic amino acid hypoglycine A. This inhibits the enzyme acyl-CoA dehydrogenase and thus beta oxidation of fatty acids is blocked, leading to various complications. Next one is the Zellweger syndrome. This is a rare disorder which is characterized by the absence of peroxisomes in almost all the tissues. As a result, the long-chain fatty acids are not oxidized. They accumulate in tissues, particularly in brain, liver and kidney. Hence, the disorder is also known as cerebrohepatorenal syndrome. Now, let's see about the Niemann-Pick disease. It's an inherited disorder due to a defect in the enzyme sphingomyelinase. This causes accumulation of sphingomyelins in liver and spleen, resulting in the enlargement of these organs. Victims of Niemann-Pick disease suffer from severe mental retardation and death and may occur in the early childhood. Next is about the Fabry's disease. A defect in the enzyme ceramidase, it results in Fabry's disease. This disorder is characterized by skeletal deformation, subcutaneous nodules, dermatitis and mental retardation. It is fatal in early life. What are the metabolic disorders of cerebrocytes? The degradation of cerebrocytes along with the associated inborn errors. The Gaucher's disease, which is due to a defect in the enzyme beta-glucosidase. As a result, tissue glucose cerebrocyte levels increase. This disorder is commonly associated with enlargement of liver and spleen, osteoporosis, pigmentation of skin, anemia, mental retardation, etc. Sometimes Gaucher's disease even may be fatal. Gaucher's disease is a genetic disorder in which glucocerebrocyte accumulates in cells and certain organs. The disorder is characterized by bruising, fatigue, anemia, low blood platelet count and enlargement of the liver and spleen, and is caused by a hereditary deficiency of the enzyme glucocerebrosidase, which is also known as glucosylceramidase, which acts on glucocerebrocyte. When the enzyme is defective, glucocerebrocyte accumulates particularly in white blood cells and especially in macrophages. Glucocerebrocyte can collect in the spleen, liver, kidneys, lungs, brain and bone marrow. Next is about the Krabbe's disease. Defect in the enzyme beta-galactosidase results in this accumulation of galactocerebrocytes. A total absence of myelin in the nervous tissue is a common feature. Several mental retardation, convulsions, blindness, deafness, etc. are seen. Krabbe's disease is fatal in early life. Niemann-Pick disease and Fabry's disease connected with sphingomyelin metabolism. Gangliosides or complex glycosphingolipids mostly found in ganglion cells. They contain one or more molecules of N-acetylmuramic acid, that is called as NANA, bound ceramide oligosaccharides. Defect in the degradation of gangliosides causes gangliosidosis, Tay-Sachs disease. Hypolipoproteinemias. What are these? Although low levels of plasma lipids, not the high density lipoprotein, within the normal range may be beneficial to the body, very low lipid levels are undesirable, and these are commonly associated with certain abnormalities. The first type is the familial hypo-beta-lipoproteinemia. It's an inherited disorder, probably due to impairment in the synthesis of apoprotein B. The plasma LDL concentration in the affected individual is between 10 to 50% of normal values. This disorder is harmless and the individuals have healthy and long life too. And the second type is the A-beta lipoproteinemia. This is a rare disorder due to a defect in the synthesis of apoprotein B. It is characterized by a total absence of beta lipoprotein in plasma. Triacylglycerols are not found in plasma, but they accumulate in liver and intestine. Serum cholesterol level is low. A beta lipoproteinemia is associated with decreased absorption of fat and fat-soluble vitamins. Impairment in physical growth and mental retardation are commonly observed. The next one is the xanthomatosis. The deposition of yellow-orange color lipids in liver, spleen and flat bones of the skull is known as xanthomatosis. This is usually associated with severe hyperlipidemia and hypercholesterolemia. Atherosclerosis is a complex disease characterized by thickening or hardening of arteries due to the accumulation of lipids, particularly cholesterol-free and esterified, collagen, fibrous tissue, proteoglycans, calcium deposits, etc. in the inner arterial wall. Atherosclerosis is a progressive disorder that narrows and ultimately blocks the arteries. Infarction is the term used to indicate the stoppage of blood flow resulting in the death of affected tissue. Coronary arteries, the arteries which are supplying the blood to heart, are the most commonly affected, leading to myocardial infarction or heart attacks. The incidence of atherosclerosis and coronary heart diseases are higher in developed countries than in the developing countries. What are the causes of atherosclerosis and coronary heart disease? The development of atherosclerosis and the risk for the coronary heart disease is directly correlated with plasma cholesterol and LDL. On the other hand, plasma HDL is inversely correlated with the CHD. Atherosclerosis characterized by hardening of arteries due to the accumulation of lipids and other compounds. The probable causes of atherosclerosis include hypolipoproteinemias, diabetes mellitus, obesity, high consumption of saturated fat, lack of exercise and stress. Atherosclerosis and coronary heart disease are directly correlated with plasma cholesterol and LDL, inversely with HDL. Elevation of plasma lipoprotein suggests increased risk of CHD. To summarize these inborn errors of lipid metabolism, they are individually rare but collectively are common. It is usually in the neonatal period or infancy but can occur at any time, even in adulthood. Diagnosis does not require extensive knowledge of biochemical pathways or individual metabolic diseases. An understanding of the major clinical manifestations of inborn errors of metabolism provides the basis for knowing when to consider the diagnosis, and a high index of suspicion is most important in making the diagnosis.